Good afternoon, everyone. Good afternoon. Good afternoon. Welcome to day 2 of our Omega Kappa Infection Prevention and Control and Non-Nursing webinar series. Thank you for joining us, and we do apologize for starting just a little behind time. We're working out the technical glitches. So welcome to evening 2, and for the persons who joined us yesterday and they're rejoining, they are aware that we have a little thing coming up to tease your brain. So my name is Cheryl Garrix Lloyd. I am the president of the Omega Kappa chapter of Sigma Theta Tau International Honor Society of Nursing. Yes, it's a long name, but the organization just calls itself Sigma. We are the only Caribbean chapter. We are located at the UE School of Nursing, Mona. And so we are the ones as a group of nursing leaders and nursing students that's having this webinar series, and it's the third one. So we thank you for joining us, and we thank all the people who asked for the series to be able to have their infection prevention and control hours and to be able to have non-nursing at the same time. So we have a lovely moderator, but before I hand over to her, we're going to do two things, and then we have two awesome presenters this afternoon. Both of them are our colleagues, and they'll be talking to us about you'll hear in a short while. So the first thing, let's do a little bit of housekeeping. Welcome to everybody here in Zoomland. Welcome to those who have joined us on our YouTube channel. Go right ahead and like and subscribe. We have no problem with that. You'll see a lot of information we've already done and shared over there. So housekeeping matters, please. A reminder that anybody who is here should have gotten an email to say, please join using your full name as you registered. In a professional setting, it is of importance that you join using your full name. We cannot assign CE hours to a Galaxy J5 2016. We cannot assign CE hours to a S Brown, or we can't assign CE hours to a Simone T. If you are joining us in Zoomland, you are going to be entered by your full name as you register. There is a register that gets marked. It's attendance that gives you CE hours in our webinar series. If you don't have your full name or you don't know how to do it, let me just give you a quick go through. When you enter here, you should be able to click on your name, and you should see a button to the side that says more. On that more button, you should be able to click it, and the option to rename should come up. You should be able to type your full name there. If you are in the session because we allowed everybody in as we are starting, and you haven't used your full name, you did not register for today's session, you are going to be put out of the session. You don't need to type your name in the Zoom chat because you have entered using your full name. However, for all those who joined us on YouTube land, we are asking you to please type your full names in the chat on YouTube so that we are sure you are over there with us. So that's just housekeeping, quick reminders. The registration link is closed at the moment. I'm just throwing it out again. We're having a professional session that we want to put on really well for you. We can't have people registering 2 minutes before the session starts or expecting that we'll be able to answer to emails when the session is in progress. We are therefore just asking persons to ensure their registration is done by 12 and to ensure you read the emails that we send with you. A lot of information is in it. So now that we've said all of that and everybody on the same page, let us find out if you are ready. Yesterday, we had to get pen and paper. Some people use their phones as the notepad or their devices. Let me put out the disclaimer. The persons who are presenting and moderating are unable to be eligible for the prize, not that they can't participate. Everybody got it? So, just a reminder, you are not eligible for the prize if you're presenting or moderating. Everybody on the same page? So, get your piece of paper and your pen quick. I was still the old-fashioned. Are you using your notepad on your phone or your laptop? Let's go. We are going to do a quick session that usually has a small prize attached to it. It's just to get us in the frame of mind and get going. Let me hear if you can open your microphones or raise your hand. Everybody have the paper or the pens and they're ready?
Yes, ma'am.
Over on YouTube, are you ready? Wonderful.
Ready.
So what's going to happen now is I'm going to share my PowerPoint so you can see. Now you will have to listen carefully to the instructions, you know, right? So now that you have your paper, we are the Omega Kappa chapter and we welcome you. So the instructions now are, it's going to be yesterday, you had 45 seconds. Today you are getting 1 minute. Who wants the 1 minute? Because the time goes quick, you know. All right, so let's get the 1 minute on the clock. See, I'm setting up the clock to get the 1 minute. So you have to listen real carefully for the instructions. So the instructions for today, you will have 1 minute and you are going to have to make as many words as you can using the two phrases on the screen. Listen to the disclaimer again. Two phrases. The first one, use it to make some words that's separate and apart from the second one. So you can't mix up the letters from the first phrase with the letters from the second phrase. Everybody on the same page? So any words you make from the first phrase, put those one side. And when you make the others from the second phrase, put that to another side. Now at the end of the 1 minute, you are going to type in the chat how many words you created. No two-letter words are being played. Everybody on the same page? Yes, I hear another somebody say unfair, no two-letter words. So at the end of the 1 minute, put in the chat. So you're going to say 5 words, 6 words, 10 words. And the person who has typed that they've made the most words, you're going to be asked to send the picture evidence. We're nurses, you know, evidence-based practice, right? So everybody ready to see the two phrases now? Everybody ready? Let's go. I'm setting the timer up. No two-letter words, 1 minute. Two separate sets of words. When you are done, put how many words you got in the chat, and then we're going to ask you to show us the evidence that you actually made these words. All right. 1 minute about to start. 1 minute has started. Go. Thirty seconds. Two, one. Time is up. All pencils are to be down. All right. So what this means now is I'm expecting to see popping up in the chat to say how many words you have actually made. As we progress, we'll come into the chat to look at how many words you've said, and we'll be able to send you the phone number for us to get the picture evidence. So with that being said, I got one request. I'm reminding everybody you need to be registered for the session. And if you are unaware of how to change your name, because we're going to be putting you out, we're asking you to hover over your name to the right-hand side, and you should see a blue button marked More. Click on that button, and when you click on that button, you should get an option to rename yourself. When you click on the rename, that is where you will type in your full name as you registered. We welcome everybody. We thank you for coming. We want to ensure we maintain our integrity. CE hours will be given to those who have registered and paid and who have joined us, and we are able to account for you. We can't do that with the names of phones or just one single name. So please change, and then we are going to have you moving right along with us for today and the rest of the series. So thank you again. And I'm going to be handing over today. Our moderator is one of our own future colleagues. She's a member of our chapter and a recent graduate of the UE School of Nursing, Mona, Miss Sidonia Lyon. Over to you, Madam Moderator.
Good afternoon, everyone. So you see, the thing is, I have already found 20 words. And I'm seeing in the chat there are 12 words and 10 words and 8 words. Definitely a pleasure to be the moderator for this afternoon, but I'm also in tears. All right. So to everyone that has joined us, whether it be on Zoom or on our YouTube channel, we're more than happy to have you. This is our second seminar of the Omega Kappa's Infection Prevention and Control third series. Remember, you can share with your friends and family and let them join us over here on YouTube so that this information can be as widespread as possible. Now, I'll take the opportunity at this time to remind us all to keep our mics muted throughout the presentations. While our presenters are presenting, if you have any questions, please feel free to write them in the chat or in the comment section of our YouTube channel. Today, we have 2 presenters, and the question and answer segment for each will be immediately after their individual presentations. You may also raise your hand at the appropriate time and wait to be acknowledged. This afternoon, we have 2 public health nurses to bring to us information on the types of immunity and vaccine preventable diseases. Our first speaker attended the UE School of Nursing, batch 100, and UTech in 2010, where she attained a Bachelor's of Science in Public Health Nursing. She worked at the UHWI, then with the Western Regional Health Authority, and is currently employed as a public health nurse at the UHWI. Her hobbies include traveling and cooking. I speak of none other than Miss Fiona Gillings. Now, please do enjoy this afternoon's presentation and thank you for joining us. I'll hand over now to Miss Gillings.
Good afternoon, everyone. Thank you for joining.
Good afternoon.
I will start my presentation, but let me state that immunity is a very wide topic, and so I will just zoom into a few of the things. Most of the items that you will hear about are things that we would have been introduced to. In school. And so we'll start with definition of immunity and get into types of immunity. And at the end of the presentation, you can ask all your questions. All right. So a very simple definition for immunity. And it is, immunity is the ability to resist infection. The immune response is the response made by the host to defend itself against a pathogen. All right, let's talk about the components of the immune system. The cells of the immune system originate in the bone marrow, where many of them also mature. Right. I'm able to see my screen now. I was having a little difficulty. So let me start over. The cells of the immune system originate in the bone marrow, where many of them also mature. They then migrate to patrol the tissues circulating in the blood and specialized systems of vessels called the lymphatic systems. And of course, we know about the B cells and the T cells. I'll repeat that lymphocytes mature in the bone marrow of the thymus, and we have a collection of lymph nodes, lymph, and lymphatic vessels that basically make up the lymphatic system. These are specialized to trap antigen and allow the initiation of adaptive immune responses. The spleen. Everybody knows the spleen is just behind the stomach and it collects the antigen from the blood. So a very important organ when it comes to immunity. Gut-associated lymphoid tissue, GALT, which include your tonsils, adenoids, and appendix, and specialized structure called Peyer's patch in the small intestine collects antigen from the epithelial surfaces and the GI tract. And we are very aware of these structures. Diffusely organized aggregates of the lymphocytes protect the respiratory epithelium, where they are known as bronchial-associated lymphoid tissue, BALT, and other mucosa, where they are known simply as mucosal-associated lymphoid tissue, or MALT. Lymphocytes circulate between blood and lymph. All right. A person's immune response is not only concerned with the ability to resist infection, but also with other ways in which the body responds to foreign proteins, as in the rejection of proteins of grafted tissue or the wrong type of blood transfusion. Immunity is determined genetically as well as through exposure to various antigens throughout life. And we can explore some of these in the question and answer segment. A little bit of history here and reminder that when Jenner introduced vaccination, he knew nothing of the infectious agents that cause disease. It was not until in the late 19th century that Mr. Koch proved that infectious diseases are caused by microorganisms, each one responsible for a particular disease or pathology. And just to remind us of these pathogens, namely viruses, bacteria, pathogenic fungi, and complex eukaryotic organisms, which we collectively term parasites. Here's a diagram of some of the common pathogens, along with examples and the diseases they cause. And we can just go through them. The bacteria pathogen, an example is Salmonella enteriditis, Mycobacterium tuberculosis, that one is easier for me, which causes tuberculosis. From the viruses, there's HIV, which causes AIDS. From the fungi, Candida albicans, which may present as thrush or systemic candidiasis. And from the parasites, which include protozoan worms, Ascaris lumbricoids, ascariasis, or we know more commonly Plasmodium falciparum, which causes malaria, the disease malaria. Just to be reminded that the human body defends itself against attack by viruses, bacteria, and other parasites by using two sets of separate but interrelated functions. At this point now, we would remember symbiosis. So these two systems that must be present and operating properly in order to block establishment of infectious agents, minimize damage caused by disease in progress, and finally expel, destroy, or isolate infectious agents that gain access to inner tissue. The phagocytes of the innate immune system. So the two systems, the first one that we'll talk about is the innate system. The phagocytes of the innate immune system provide a first line of defense against many microorganisms and are essential to the control of common bacterial infections. However, they cannot always eliminate infectious organisms, and there are many pathogens that they cannot recognize. Here comes the adaptive immune system. So the first one was the innate. We'll talk about the adaptive immune system now. The lymphocytes of the adaptive immune systems have evolved to provide a more versatile means of defense that, in addition, provides an increased level of protection from a subsequent reinfection with the same pathogen. The cells of the innate immune system plays a crucial part in the initiation and subsequent direction of the adaptive immune responses. Moreover, since there's a delay of 47 days before the initial adaptive immune response takes effect, the innate immune response has a critical role in controlling infections during this period. I'll explain that. So basically, the innate immune response system is a precursor. It acts, we could say, like a first aid. And then when the adaptive immune system controls take over, it's more like you're getting medical care in an established setting. All right. Adaptive immune response. A specific immune response, such as the production of antibodies to a particular pathogen, is known as immune response because it occurs during the lifetime of an individual as an adaptive response to infection with that pathogen. In many cases, an adaptive immune response confers lifelong protective immunity to reinfection with the same pathogen. And an example of this is chickenpox. Perhaps chickenpox is not the best, but I'll explain. It's not that you can't get it again, but the severity. So we have to, immunity is very complex. But please ask your questions at the end of the presentation. All right. So this distinguishes such response from innate immunity. Eloy Mechnikov, a Russian microbiologist, discovered that many microorganisms could be engulfed and digested by phagocytic cells, which he called macrophages. These cells are immediately available to combat a wide range of bacteria without requiring prior exposure and act in the same way in all normal individuals. So we go back to the first aid aspect of things. And this is specifically to innate immunity. Let's talk a little bit about antibodies. Antibodies, by contrast, are produced only in response to specific infections, and the antibodies present in a given individual directly reflect the infections to which he or she has been exposed. And that is self-explanatory. All right, we are actually coming towards the end. And surface defenses is a type of immunity. Resistant components are usually the first to encounter infectious agents or parasites. Barriers, intact skin and mucous membranes are sufficient to prevent penetration to underlying tissue by many pathogens. Biochemical defenses such as the lysozyme in tears, bile in the gut, hydrochloric acid in the stomach. These are all lethal to pathogens. And surface clearing mechanisms, including washing of oral surfaces by saliva, tear washing, urine flushing, and the cough reflex are such examples. Let us be reminded that a few mucous organisms evade these blocks to their advance, among them being those that, like the malaria parasite, are infected through the skin by the stings of the arthropods. Others go straight in through cuts and abrasions, and the most notorious is tetanus. To a lesser degree, anthrax that well, we don't know much about anthrax, but tetanus, yes. There are a few that can find their own way in through intact mucous membranes, notably the causative agent of syphilis, Treponema pallidum. All right, this big word now. Autochthonous flora interfere with colonization of pathogens by both function and habitat, location, competition. And you can ask your questions where this is concerned. You know, there are normal bodies has normal flora, different areas, and they serve to aid in immunity. All right. Let's get into the blood system a little bit. Reticular endothelial system, or RES, which includes mononuclear phagocytic cells, or what we refer to as the macrophages. And these you can find in the sinusoid of the liver, the spleen, the bone marrow. It monitors the circulating blood and removes all foreign particles and any dead cells. You find them also in the alveolar spaces. And anything that tends to come into the lungs, they will act to remove. Inflammation is another type of response. It is a combined fluid and cellular response to tissue injury, septic or sterile, that acts to clear debris, remove or neutralize septic agents, and set the stage for repair of damage. And there are two types of inflammation, acute and chronic. Acute inflammation follows sublethal tissue injury. The chief cell is the neutrophil. It is usually quickly resolved, whilst in the chronic inflammation, it occurs when when an injury is prolonged and the resolution is slow and may persist for years. And then there's an acute phase response. So there is chronic and acute, and then for the acute phase response, for the type where there is a systemic response that attends a strong local inflammatory response. Many aspects of the acute phase response are initiated by the actions of cytokines produced by stimulated macrophages. Just to repeat. The natural killer cell system, or NK, are a poorly understood group of lymphoid cells that make up to 5 to 10% of the circulating lymphocytes, and they are involved in killing some tumor cells and some virally infected cells. And I included them because though they are small, they are powerful. So an individual can become immunized by direct, active, or indirect, which is termed passive means. In active immunity, the individual produces effector units following stimulation by antigen. Natural immunity is produced by disease and environmentally acquired allergies. And artificial immunity is produced via vaccination and allergies from therapeutic drugs. Whilst in passive immunity, it is protection provided from the transfer of antibodies from immune individuals, most commonly across the placenta, or less often from the transfusion of blood or blood products, including immunoglobulin. Of course, the mother-to-child cross-placental transfer plays here, and some of those protection. Let me just go again. The cross-placental transfer of antibodies from mother to child is more effective against some infections, for example, tetanus and measles, than for others. For example, polio and whooping cough. This protection is temporary, which is passive immunity, and it lasts only for a few weeks or months. The individual receives effector units that are produced by an animal, another human, or gene engineering procedures. Natural immunity is produced via colostrum, topological protection in human and across the placenta, which is systemic protection in humans. Artificial immunity is produced by immune globulin, for example, ROGAM, and genetically engineered human antibody. Sorry. And last, I'll mention herd immunity because that is very common. It's a form of indirect protection that applies only to infectious diseases that are contagious, that occurs when a sufficient percentage of a population has become immune to an infection, whether through previous infections or vaccination, thereby reducing the likelihood of infection for individuals who lack community. So basically, it's a group of people who would have a fence and they stay within that fence, and because they stay within that fence, those persons outside are less likely to come down with the disease because they really do not get in contact with each other. Once herd immunity has been reached, diseases gradually disappear from a population and may result in eradication or permanent reduction of infection to zero if achieved worldwide. And of course, I think this is what we want to achieve where COVID-19 is concerned. Herd immunity created in a vaccination. I don't think that is what that is supposed to read. Herd immunity created via vaccination has contributed to reduction of many diseases. And so I'll conclude by just summing up everything to say that the immune system is an extremely complex system. It has evolved through the years to become a pervasive and highly structured group of complex functions that defend the body against pathogens and parasites from the outside and are able to detect and attack altered cell cells that pose threat to organismal homeostasis. Thank you.
Thank you so much, Nurse Gillings, for your very informative presentation. You definitely brought me back right to nursing school into epidemiology class. Now, before we go on to the second presenter, we have the question and answer segment. I'm not seeing any questions in the chat thus far. I'm not sure if there's any over YouTube.
Not at the moment, but I will check momentarily.
Oh. If you have any questions, you may just go ahead and raise your hand or type it in the chat and I'll read it out for you.
We also take comments and recommendations and suggestions.
Presentation well done. I'm seeing that from Rahima Guscott.
I have a question, if it's okay, Madam Moderator.
That's
sure,
fine.
Go ahead.
That's fine.
I know that we're talking about herd immunity and everybody has the COVID vaccine on the top of their heads. But I want to find out if it's possible. I know it can be maybe technical. Yeah, you're the expert. Exactly how do we achieve herd immunity?
All right. So one of the ways in which we achieve herd immunity is by numbers. So it has to be a certain percentage of the population that would be protected against this disease in order to offer the rest of the population herd immunity. So it has to do with percentage or numbers. We tend to aim at 95%. So if 95% of the population is covered in terms of a disease, vaccination, then we can say that herd immunity is achieved.
Thank you. Any idea how far we are from that? Because I assume we are very far regarding
we are very
COVID.
far. We are very far because we've only attained 25% of vaccination.
Thank you so much, Ms. Gillings.
Yes.
All right, and I am now seeing a question. Good evening. Can you explain the RES a little more?
Reticular. All right, so basically, let me go back to, whoa, how do I do this now? Right. So this is it. So basically it has to do with phagocytic cells or macrophages. And what macrophages do, their best thing is to engulf whatever organism that's there, swallow them, and by swallowing them, basically kill them. If you remember Pac-Man, that little disc thing opens its mouth and just swallows whatever is fed to it. The idea is the same, and it eats it. Sorry? Is that good enough?
Yes, thank you. And YouTube, Antoinette Graham is asking, could you repeat where lymphocytes mature, please?
Okay, so lymphocytes mature in the, see with me, spleen, is it a spleen? Oh, I think I've passed it. All right, can we go to another question? If there's one, let me just ensure that I give you the correct information. Yes, so the cells of the immune system originate in the bone marrow, where many of them also mature. Did I answer the question?
Yes, thank you.
Okay.
And I'm not seeing any hands, neither am I seeing any more questions in the chat or from YouTube. I'll give us another minute.
All right. So while you're giving the minute, just in case anybody has a last minute question, let me just stick my head in for 2 seconds to say, I saw a Jodian Hall and an Elizabeth Pina. I put my number in the chat and asked them to send me their picture evidence because they both said that they made 12 words. So I'm waiting on the evidence so we can see if we have 2 winners for today's session. Thank you.
It's mature. Oh, in the bone marrow of the thymus. I'm sorry. Lymphocytes mature in the bone marrow of the thymus. Well, yeah.
Thank you. All right, so thank you, Ms. Gillings, for that, again, very informative presentation. And we're going to move over to our second presenter for this afternoon, who happens to be our very own chapter member, Mrs. Deborah Udu, who has been a registered nurse for over 20 years. She's also a registered midwife, and as I mentioned before, a public health nurse. She has a master's in science in nursing education and currently works at the Kingston Public Hospital. Please, once again, do enjoy her presentation. And for those who have joined after, thank you for joining. That's both on YouTube and Zoom. I'm now seeing 52 participants. Very happy about that. Miss Udu, I turn over to you.
Miss Elizabeth Pina, could you please remove this from the screen? Thank you. You may go ahead, Mrs. Udu. Sorry about that, everybody.
Good afternoon, everyone. I appreciate the opportunity to present on this platform. Thank you so much, Mrs. Garrett Lloyd. Thank you so much, Ms. Lyons, and welcome everyone to this presentation. This evening, We are looking at vaccine preventable diseases. Can everyone hear me, please?
Yes, we can hear you, Mrs. Udodo.
Thank you. What are vaccine preventable diseases? As the topic implies, they are diseases that can be prevented by vaccines. As deadly as these diseases sound, and they are, just 1 or 2 vaccination terminates their process of development, their signs and symptoms, and also their complications. What are these vaccine preventable diseases? They include tuberculosis. Tuberculosis can be prevented with just 1 BCG, 1 vaccine, Bacilli calmette guerin. Haemophilus influenza type B can be prevented with 3 doses of Hpv vaccine. Hepatitis B can be prevented by 3 doses of hepatitis B vaccine. Influenza, which is the regular flu, can be prevented with a yearly flu vaccination. Because of the variation in strains, there's the need to get vaccinated on a yearly basis, depending on the strain presenting that season or that year. Measles can be prevented with MMR, measles, mumps, rubella, and 2 doses are required. Meningococcal disease can be prevented with or by meningococcus vaccine, and 2 doses are needed. Mumps can be prevented with 2 doses of MMR, pertussis, which is also known as whooping cough, can be prevented with 3 doses of vaccinations. Pneumococcal with 2 doses of vaccinations, polio myelitis with 5 doses, rotavirus with 2 doses of vaccines, rubella with 2 doses, varicella with chickenpox vaccination, human papilloma virus can be prevented by 3 doses of the Hpv vaccine. Tetanus disease requires 5 doses of vaccinations. Herpes zoster, which is also known as shingles, can also be prevented with vaccination. Diphtheria is also preventable with vaccination. What is the global burden of these vaccine preventable diseases? More than 5.5 million people worldwide die from vaccine preventable diseases each year. We can see how much of a concern to global health that this is. An estimated 700,000 children die of vaccine preventable diseases. About 2 to 3 million lives are saved from infectious diseases every year through routine vaccination. We are going to look at brief history of these vaccine preventable diseases. Cholera pandemic happened between 1846 to 1860. And over 1 million lives were lost. This pandemic would have been prevented with just 1 dose of the cholera vaccine, that is the Vaxchora vaccine. However, then it was the dark era. Technology wasn't that developed, and so the vaccine wasn't born. It was the pandemic that led to researches and so many ongoing studies which gave birth to this cholera vaccine. And as we all know, cholera is no longer so much of a threat to public health. It is still of public health concern, but we don't have that pandemic. We have never experienced a pandemic as serious as that of 1846 to 1860 because of the invention and the production of Mmr Vaccine. Spanish flu pandemic happened between 1918 to 1920. It was caused by the H1N1 virus, and it claimed about 17 to 100 million lives. And this would have been prevented if the flu vaccine was available then. However, we are grateful to God and to technology that we now have the flu vaccine, and so many lives are saved on a yearly basis. We are all witnesses to what COVID-19 pandemic did. It claimed about 24.3 million lives globally. Those were the numbers reported. And presently, with Pfizer, AstraZeneca, Johnson & Johnson, the infection, the disease is under control. We had Ebola, which started in some African countries in 1972. It was ended in 2017 with the birth of Hpv Vaccine. Smallpox was completely eradicated, and it was reported on May 1980. The eradication was in 1978, but the declaration was made by the World Health Assembly in 1980. So we no longer have smallpox globally. Globally, type 2 and type 3 poliovirus has been eradicated with vaccination. And these vaccine preventable diseases are not just threats to children or young adults. All age groups are at risk. And so vaccinations are encouraged for all age groups. What are some of these diseases common with children, young adults, and elderly people? All vaccine preventable diseases affect all age groups. The only difference is the rotavirus, sorry about that, which affects children below age 6. We are going to look at these vaccine preventable diseases one after the other. We are starting with tuberculosis. Tuberculosis is a lung disease. It affects the alveoli of the lungs. And the signs and symptoms affect every organ of the body. It is caused by Mycobacterium tuberculosis. It is a bacteria. It has both latent and the active phase. It is an airborne disease which is easily transmitted or easily spread where there's overcrowding or poor living condition. All age groups are at risk, and the incubation for this disease, incubation period is 4 to 6 weeks. What are the signs and symptoms of tuberculosis? We have generalized body weakness. We have fever, weight loss, night sweats, cough, hemoptysis, which is coughing up blood, chest pain, stunted growth, and failure to thrive in children. What are the complications of TB? We have spinal pain, arthritis, kidney or liver problems, heart disorder, and it can lead to death if not properly treated. How can this disease be prevented? BCG is a vaccine given to protect children against tuberculosis. It is usually given at birth, and can be given up to 2 weeks after birth. BCG is one of the compulsory vaccinations in some countries, like Jamaica. However, it is not mandatory in countries where tuberculosis is not so much of a threat. How can this disease be controlled? I talked about immunization earlier, and also early detection and treatment. When the disease is contracted and not treated, the host continues to spread this bacteria. And this disease is not just contained to the person who contracted the illness first. A lot of other persons fall victim. So early detection and treatment is pivotal and important in curbing tuberculosis. Diphtheria is called the disease of the mouth, throat, nose, or skin. It is caused by Corynebacterium diphtheriae. It affects children that are not immunized under the age of 15. The toxin produced by this bacteria affects the heart, the nerves, the brain, and causes serious complications like myocarditis, neuritis, thrombocytopenia, and also resultant proteinuria. Diphtheria is transmitted through coughing, sneezing, or skin ulcers. The host can be asymptomatic. However, the host may continue to spread this bacteria, spread this infection. What are the symptoms and signs of this illness? We have fever, painful sores on skin, sore throat, loss of appetite, generalized body weakness, and then a white coating on the tongue, which can become grayish or black in color. This coats both the tongue, the tonsils, and also the throat. What are the complications of diphtheria? Airway obstruction, inflammation of the heart muscle, paralysis, and death. This illness can be treated with penicillins or erythromycin. It can be prevented with DPT vaccination. That vaccination is present in the pentavalent that is administered to 6 weeks old, 3 months, 6 months, and then the boosters are given at 1 year, 6 months, and also 4 years, 6 months. So in all, 5 doses are needed to cover one for lifetime. Some children started their vaccinations early and were able to complete their vaccination schedule. However, if as an adult, the childhood vaccinations were not administered as supposed, an adult cannot be given the pentavalent injection vaccine. They have to be given DPT. The first dose at first contact, the second dose 4 weeks after, the third 6 months after, and then the rest is completed as boosters. We go to whooping cough. Whooping cough is caused by Bordetella pertussis. It lives in the mouth, the nose, and throat. It is common with non-immunized people. It can be spread through droplets and when an infected person coughs or sneezes. Incubation is 6 to 21 days. And during this incubation period, they are highly infectious. They can easily transmit these diseases if not on treatment. What are the signs and symptoms of this illness? There are 3 stages of pertussis. High fever is not common at any stage. There may be high fever, there may not be high fever, depending on the level of immunity that the host has. Stage 1 involves cold, running nose, watery eyes, sneezing, fever, and mild cough. Stage 1 takes place or happens between the 1st to 2nd week of infection. Stage 2 is from the 1st to the 6th week of infection, and it is characterized by coughing spells, and the coughing comes with this sound, whoop. The child may turn blue because of exhaustion and the use of energy, strength to produce the cough. The child may be tired. Vomiting may follow or may happen after coughing. Stage 3 involves a reduction in the coughing spells. What are the complications of whooping cough? We have pneumonia, ear infection, seizures, encephalopathy, and of course, death. Whooping cough is treatable. It is caused by a bacteria, so it can be treated with erythromycin. And the prevention can be through vaccination with pentavalent and DPT. Tetanus is another vaccine preventable illness. It is also called lockjaw. It is an acute disease caused by Clostridium tetani. This organism produces a toxin that affects the nerves, the muscles, and causes constriction or contraction of the muscles. This narrows the lumen of the airway and also affects the muscle tone. Clostridium tetani is present in soil, manure, contaminated knife, nail, thorn. The incubation is 3 to 21 days in adults and 4 to 14 days in children. It can be transmitted to the newborn when a dirty instrument is used to separate the umbilical cord, to cut the umbilical cord. When the umbilicus or wound is dressed with cow dung, as in some culture, with ash or charcoal or any form of dirt, tetanus can be introduced into a host. When circumcision is conducted with unsterile instruments, also the piercing of body parts can lead to the introduction of tetanus to the host if the instruments are not properly sterilized. What are the signs and symptoms of this disease? We have stiffness of the jaw and neck, difficulty in swallowing, muscle stiffness, fever, sweating. The neonate stops sucking in neonates because of the constriction of the airway and also the stiffness of the muscles. The neonate is unable to suck. Neonates can also have seizures, fits, and deaths may occur if not treated. The complications include fracture. Remember, there's constriction or contraction of the muscles, so fracture can result. Abnormal heartbeat, high blood pressure, pneumonia, coma, and death. Tetanus can be prevented with antibiotics. There should be airway clearance because of the constriction of the lumen of the lungs, and also wound dressing if it is caused by contaminated instrument or if there's an open wound. Tetanus immune globulin can also be introduced to the host or used to treat the illness. Vaccination will not help if an infection is established. Vaccination is for prevention, not when the illness is established. Hepatitis B is another vaccine preventable disease. It is a disease of the liver, and it is caused by a virus. It is conveyed by infected blood or saliva, semen, vaginal discharge, or secretions. It can also be transmitted by the use of infected needles or syringes. The incubation is 3 to 6 months. It can as well be transmitted through blood transfusion, sex from mother to baby, through the umbilical cord, through contact with cuts, scrapes, or scratches. If an infected person uses a toothbrush and another person utilizes the same toothbrush, if there's any cut in the mouth of the second user, hepatitis B can easily be introduced to another host. What are the signs and symptoms of this illness? We have anorexia, we have nausea, arthritis, skin rashes, fever, headaches, dark urine, fatigue, jaundice, pale stool. It is a disease of the liver, and once the liver is affected, then the metabolism of bilirubin is affected, thereby leading to the excess secretion of bilirubin, of bile, into the bloodstream. This results in jaundice. And the enlargement and tenderness of the liver is also signs and symptoms of this disease. What are the complications? We have cirrhosis of the liver. That is the formation of cancerous cells or fibrous cells in the liver. We have liver failure, liver cancer, and death. Hepatitis B has no treatment. It is a viral infection, and as we all know, viral infections are self-limiting. So it is best to prevent it by getting full vaccination. Disease process can be stopped by antivirals such as interferon and lamivudine. Immunization with hepatitis B is a sure way of not getting infected with the disease. Haemophilus influenza type B, which is simply called Hb, is another infection caused by a bacteria. It can be spread through discharges from eyes, nose, mouth of infected persons. The signs and symptoms include drowsiness, high fever, neck stiffness, poor feeding, headaches, vomiting, wheezing, skin, ear, and joint infections. It can be complicated with pneumonia, meningitis. The treatment can be done with cephalosporins, penicillins, and chloramphenicol. This illness can be prevented with the Hpv vaccine. 3 doses are usually given. As I said earlier, the pentavalent is a 5-in-1 vaccination, and part of the component of that vaccine is Hpv. Polio Myelitis, also known as acute flaccid paralysis, is a vaccine-preventable disease caused by the polio virus. The last case of this illness was reported in the English-speaking Caribbean in 1982. That was in Jamaica. It can be spread through fecal-oral route, and it thrives more where there's poor sanitation. What are the signs and symptoms of acute flaccid paralysis? Fever, sore throat, loose stool, upset stomach or stomach discomfort, headaches, stiffness in neck, back, and legs, and also paralysis. As the name implies, it causes paralysis to both limbs, upper and lower limbs. The complication can be permanent paralysis, and it can also lead to death. There's no cure for poliomyelitis. It is a viral infection, and it can be prevented with or by the oral polio vaccination or the inactivated polio virus vaccine. The inactivated polio virus vaccine is usually given to babies at 6 weeks, followed by the oral polio vaccines at 3 months, 6 months, 1 year, 6 months, and then 4 years, 6 months, making 5 doses in all. Jamaica has been certified free of poliomyelitis. However, we heard about emerging and re-emerging diseases, so we are not letting down our guards. Some of these illnesses can come up at any time. We know about international travels. People travel from place to place, and illnesses can also be carried or transported from one region to another. Some regions that have been declared free from some illnesses have been reported in recent times to have such illnesses based on migration and the possibility of emerging and re-emerging diseases. Measles is a viral infection that can be spread with nose and throat secretions of an infected person. It is an airborne droplet infection released during sneezing or coughing. The signs and symptoms of this disease have stages. Stage 1 is from the 1st to the 7th day of contracting this illness. It is characterized by fever, cough, runny nose, also known as coryza, conjunctivitis, inflammation of the conjunctiva of the sclera and the lids, small white spots called Kolpik spots. The second stage is from the 3rd to the 7th day. It is characterized by red rashes, loss of appetite, and loose stools. This illness can be complicated by pneumonia, ear infection, severe diarrhea, encephalitis, seizures, blindness, and death. The virus affects the lungs, it affects the eyes, it affects the nerves, it affects the GI system, and results to all these complications. Measles can be prevented by the MMR vaccine. MMR is measles, mumps, rubella. It's a 3-in-1 vaccine. It is usually given 2 times, at 1 year and the second dose at 1 year, 6 months. For adults who missed out on their childhood vaccinations, they can get 1 started at first contact and then come back 4 weeks after to complete the vaccine. Treatment is symptomatic, and vitamin C is also used because of the complication or the possible complication of blindness. Mumps is an acute illness which can be prevented by the MMR vaccine, 2 doses of MMR vaccines. It is an airborne droplet infection which can be spread through sneezes, cough, infected nose and throat secretions. After 2 to 3 weeks, the virus spreads to the salivary glands, ovaries, and the testes, travels through the bloodstream. What are the signs and symptoms of mumps? Muscle pain, loss of appetite, headaches, fever, fatigue, swollen salivary gland. Now, sometimes when persons have mumps, they say it is just mump and it will soon ease off. I will soon be relieved of mump. It is more than that. So mump requires intervention because of its possible complication on the ovaries and the testes. And that might not be immediate, it might be later on in life. It can lead to infertility in both males and females. The complications of mumps include meningitis, pancreatitis, hearing loss, swelling and tenderness of the testes, which is orchitis, and ophoritis. What is the treatment for mumps? It has no specific treatment. It can only be prevented by MMR vaccine. For mumps, treatment is symptomatic. Rubella is a viral infection that most seriously affects the developing fetus. It spreads through the placenta, it passes through the placenta to the unborn child. It can be transmitted through contact with secretions from nose and mouth. It can spread from the mother's blood to the child, causing congenital rubella syndrome. The signs and symptoms of this illness include rash, fever, and symptoms of cold. And rubella can be prevented by 2 doses of MMR. It is a component of the measles, mumps, rubella vaccine. What are the complications of rubella? I said earlier that it can be transmitted via the placenta to the unborn child, thereby leading to retardation in growth and development. The child, after being born, can present with a small head and can have some mental issues. There can also be meningitis. Cataract, glaucoma, or eye inflammation are also part of the complications. Deafness in one or both ears, heart conditions, hepatitis, or a large liver or spleen are also part of the complication. Low birth weight, blood thinning, lung problems, thyroid diseases are some of the complications of rubella. There's no treatment. It can only be prevented with a vaccine or by a vaccine. Yellow fever is another viral infection that can be prevented by vaccinations. It is not one of the childhood vaccinations in this region because it is not an endemic disease in Jamaica. However, other Caribbean countries like Guyana, Panama, Suriname, Trinidad and Tobago, and some South American countries are endemic for yellow fever. Hence, when an individual is traveling from a non-endemic region to an endemic region, yellow fever vaccination is required. If a Jamaican is traveling to any of the South American countries, then yellow fever vaccine is required. And usually the evidence of vaccination is asked or requested at the airport by the public health nurses. Yellow fever can be transmitted through the bite of an inactive Aedes aegypti mosquito. We have these mosquitoes here. However, we don't have the virus. We have the hosts, we don't have the disease, we don't have the virus. So if an infected person comes into the region, then we are at risk. It is not spread from person to person. The mosquito is the vector that transmits the disease. It produces a lifelong immunity after recovery. Viral infections are self-limiting, they produce lifelong immunity, so also is yellow fever. What are the signs and symptoms of this illness? We have fever, chills, headaches, generalized muscle pain, abdominal pain, vomiting. Some complications of yellow fever include liver and renal failure, and it can also result to death if not properly treated. Yellow fever can be prevented with the yellow fever vaccine. Only one dose is needed for lifetime. And this vaccination is usually taken at least 10 days before embarking on an international travel. Full coverage is not produced immediately after vaccination is administered. 10 days is needed for the full coverage to be activated in the system of the hosts. Meningococcal disease is another vaccine preventable illness caused by a bacteria, Meningococcus. It has 5 strains. The serogroups include A, B, C, Y, and W135. It can be transmitted by direct contact with infected nose and throat secretions. The signs and symptoms include fever, headaches, stiff neck, photophobia, sensitivity to light, nausea, vomiting, altered mental state. It causes lethargy, delirium, and coma. This is because the toxins produced by the Meningococcus bacteria can travel through cerebrospinal fluids to nerves, the brain, and the sections of the spinal cord, thereby resulting in these signs and symptoms and its complications. The complications include deafness, limb loss, neurologic neurologic symptoms, which include seizures, mental retardation. It can also lead to death. Treatment can be done by using antibiotics. Before the commencement of the antibiotic regimen, there's need for cultures so as to know the right antibiotic or spectrum to use or utilize for the treatment. Broad spectrum antibiotics can be used. Penicillins are also drug of choice. Prevention can be through the meningococcal vaccine. This vaccine is active against all the strains of the virus. Varicella, known as chickenpox, is caused by the varicella zoster virus. It can lay dominant in the nervous system following initial infection and reactivation as shingles, known as herpes zoster. It can be spread by contact with inhalation of infected respiratory secretions or vesicular fluid from body wounds or lesions. Chickenpox is highly communicable. It is contagious from the first day before even the rash appears. And the incubation is 2 to 3 weeks. What are the signs and symptoms of this illness? We have rashes, which appears first as macules, then develops to papules, vesicles, and then crusting. And it comes with itching when it comes to the crusting stage. It is characterized by fever, generalized body weakness, and a lot of discomfort. The complications of this illness include pneumonia, meningitis, encephalitis, congenital varicella syndrome, which happens or is seen in the newborn, results to low birth weight, limb hypoplasia, muscular atrophy, and brain abnormalities. Chickenpox can be transmitted to the unborn child via the placenta. The treatments include symptomatic treatment, and the vaccine is usually administered to prevent infection. Pneumococcal disease are a group of illnesses which include pneumonia, bacteremia, meningitis, and otitis media. It can be spread by droplets where people live in overcrowded conditions or unhygienic environment. This illness can be complicated. Before I go to the complication, I want to talk about the signs and symptoms. These include fever, sensitivity to light, drowsiness, neck stiffness, headaches, vomiting, irritability. Coma can also be experienced with pneumococcal disease. It can be complicated by pericarditis, endobronchial obstruction, formation, mastocytitis, and hearing loss. This illness can be treated with penicillins, cephalosporins, erythromycin, chloramphenicol, and the signs and symptoms can also be treated based on what the patient or the host is presenting with. Prevention is with immunization, with pneumococcal vaccines. These vaccines are not part of the regular immunization schedule, especially for Jamaica. However, persons engaging in international travel, persons without spleen, maybe they had accident, surgery, or disease that affected the spleen, are given pneumococcal infection to boost their immune system. Sickle cell patients are also given pneumococcal disease. It is an essential vaccination. Though it is not part of the vaccination schedule, it is an essential vaccination. Some persons get it done privately. Influenza is called the flu disease or the flu infection. It is highly contagious, caused by a virus. And the types are type A, B, and C influenza infection based on the strain of the virus causing the illness. Type A is most often the cause of pandemics. Just like we have the influenza A, the H1N1, that caused the Spanish flu pandemic in the 80s. We also have the one we're battling with now, COVID-19. We have the ones that we vaccinate against every year on a yearly basis, all right? So it is the most cause of pandemics. And this infection can be spread through droplets. The incubation is usually 1 to 5 days. The treatment is supportive, symptomatic treatment. There's no specific treatment for influenza. It can be prevented with or by the influenza vaccine. It is usually done on a yearly basis because the influenza virus that presents the previous year might not be the existing one for the present year. Based on the strain, vaccines, based on the strain of the virus, then vaccination varies every year on a yearly basis. So the one given last year might not be the one obtainable for the present year. The signs and symptoms of influenza include fever, chills, headaches, sore throat, dry cough, nausea, vomiting, and it can be complicated by bronchitis, pneumonia, and otitis media. The rotavirus is a virus that causes rotavirus enteritis. It is common in children less than 6 years of age. It usually affects the gastrointestinal organs. It causes fatal diarrhea, severe diarrhea in children, and 100% of children are usually infected within 24 months of age. It is transmitted through the fecal-oral route with contaminated food or water. It can also be transmitted through droplets. The incubation for this illness is 1 to 3 days. It can be complicated by severe diarrhea, electrolyte imbalance, and death. The signs and symptoms include fever, vomiting, explosive watery diarrhea. Treatment is supportive with ORS or IV fluid if the child is taken to hospital. The prevention is by rotavirus vaccine. The human papilloma virus infection is an infection that can affect both males and females. It usually leads to warts and cancers of the cervix, vulva, penis, and anus. Out of the 40 types of this strain, these viruses, only 16, type 16 and type 18 are known to cause cancers. Types 6 and 11 are responsible for genital warts. This illness is spread through sexual contacts. The signs and symptoms include PV bleeding after intercourse, and it may also present as genital warts. It can be complicated by warts and cancers. Treatment can be through the cauterization of the warts. Prevention is usually through pap smears, which should be done by persons without abnormal pap smears once every 3 years. If you did the first pap smear and repeated another pap smear and they are both normal, then you can do one every 3 years. But if there's anything treatable from the previous pap smears, then it has to be done once every year. Pap smear is a way of detecting HPV infection early. And another preventive measure is safe sex, the use of condom or abstinence. HPV vaccine can also be used, can also be given to protect the host, to protect individuals from these invading cells, especially those who are sexually active. And it is advised that these vaccinations commence between age 15 to 26. Anything after age 26, you're not going to get the maximum benefits because persons are already sexually active at that stage. So it is advisable to complete the HPV vaccinations within age 15 to 26. And from all that has been said so far, we can see that vaccine preventable diseases can be prevented. They are fatal. They have serious global effects, serious public health effects. However, they can all be prevented with adequate and proper vaccination. Thank you very much for listening.
And thank you very much, Mrs. Odu, for an understandable presentation. For those of us with our vaccination cards and with children that you might have taken to get their vaccine, or shots as we often call it, I know we now have a better understanding on the importance of getting vaccinated against these preventable diseases. Now we're on to our question and answer segment. As we did before, you may go ahead and type your question in the chat. You may raise your hand. And if there's any from YouTube, Mrs. Garrix will type it here. awesome presentation, Nurse Udo. That's from Sandra Chisholm Ford.
Thank you.
You're welcome. Very interesting.
Madam Moderator, if I may take the president's privilege, because my hand is raised, right? And I think there's another hand. Thank you. Oh, you're not seeing the hands. All right. So thank you so much to both our presenters. Thank you very much, Nurse Gillings. I hope people who are listening, you know how this works. But my questions are for Mrs. Udo, if I may. I heard in the news, the first one is I heard in the news last week that we had some confirmed cases of tuberculosis. And I was like, wait a second, I thought we didn't have that. I wanted to ask if we've heard of any such other diseases that we may have not had for a while, and perhaps why do we think these particular ones are coming up right now? And then my second question would be, I heard her saying it for some of the vaccines that it's 1 dose for a lifetime. I had a second question. Let me know when you find my card, it's so old. Is it that I need to get boosters for some of these vaccines that I would have gotten a long time ago?
Thank you so much, Madam President. Thank you so much, Madam President. Yeah, surveillance is an ongoing thing. And as we all know, we are trying to heighten surveillance because of emerging and re-emerging diseases. Sometimes it is not that these illnesses are not there. However, when persons are not being tested for tuberculosis, how do we know that they have tuberculosis? So sometimes it is when they present at the health facility and whatsoever symptom they present with. And we also know that persons travel from time to time. If you heard the news, there's an outbreak of meningococcal infection in Florida. So persons might be traveling to Florida, or maybe we have persons there right now that might be coming home later on. We have not had a case in a while, especially at my institution, but with persons traveling from time to time and these emerging and re-emerging diseases, anything is possible. And as I said earlier, we are heightening surveillance because of these emerging and re-emerging diseases. And going to your second question, if you had yellow fever 10 years ago, 20 years ago, you don't need a booster. Once vaccinated, you're covered for lifetime. But if you had tetanus injection, tetanus vaccine, maybe you had 4 doses and it is now 10 years after the 4th dose, you need a booster. 5 doses are needed to get you fully vaccinated for life, especially women of childbearing age, a woman of childbearing age. So if you had the last dose, maybe 14 or 10 years ago, you still need to take your booster to complete your vaccinations. For some vaccinations, yes, you need booster. For others, boosters are not necessary. One vaccine produces the lifelong immunity, such as yellow fever.
Thank you very much, Mrs. Udo. I was over here clapping and saying, oh, great responses. And then you said, oh, if it was for tetanus, you need 1 more. And I'm like, oh my God, no, I have to go and check my card. Well, thank you.
You're welcome.
I'm seeing Miss Kumari Sernash with her hand up. You can go ahead.
Yes, thank you. Thank you for your presentation, Ms. Udo. I have a question about the HPV vaccine, though. In the latter part of your presentation, you mentioned 2 important points at which it's important to get the vaccine before. You mentioned before sexual activity and before 26 years old. And you said that, usually by 26, most persons would have been sexually active. However, what if a person is 39 years old and not sexually active? Can that person still get the HPV vaccine and it be effective?
Thank you for that important question. Yes, I still advise persons to get the vaccination. Some persons over 26 years of age might, usually come to me and indicate interest in wanting to get the vaccine. I educate them on the benefits they are going to get. And some will still say, if I'm getting something, I still want it. So one who is not sexually active will benefit much from that vaccine. So I will encourage somebody, just like the scenario you used, to please go for the vaccine. 3 doses and she's covered.
Thank you so much.
You're welcome.
All right, so in the chat, I'm seeing very informative presentation. That's coming from Anna K. Brown, very informative, a host of information. That's from Andrea Saunders. Very informative presentation, educational and informative. Third, polio at 6 months is IPC. That's Alicia Bennett. And I'm seeing Miss Sandra Chisholm Ford with her hand up. You can go ahead.
Thank you, Madam Chair. I just wanted to add a little comment to help with the response. Mrs. Serenash's question. Because the is found to be the slowest spreading cancer of all cancers. So the benefit of the HPV vaccine for persons who would have been in the early stage of a cancer has been proven. So even if the person was exposed to HPV, it has been scientifically proven that that person could benefit from the vaccine regardless. And another point is that next week will be observed as Cervical Cancer Awareness Week. So we are imploring our ladies to go out and get your pap smears done.
Thank you. I'm not seeing any more hands. Do we have any more questions?
YouTube land is all quiet, Madam Moderator.
Oh,
I don't know if
wow.
they're waiting and then the questions and the comments will pop up, but it's all quiet on that front.
And Miss Jennifer Sands says detailed session. I agree. Do we have anything from YouTube, Justin?
No, but we have one more hand over here. Our first
Oh,
presenter
right.
has her hand up.
Right, our first presenter, Miss Fiona Gillings. You can go ahead.
Thank you very much. Excellent presentation, Miss Udu. One of the questions that I think wasn't answered that I'd like to help with because I've experienced it is they asked if there was any disease that had been seen that
I mean, we're supposed to have eradicated or something to that effect, right? There's this disease that we saw. It's called Hansen's disease, better known as leprosy. We had a case of that up to last year. And I think one of the reasons we saw it, which is what you alluded to, is because of oh my goodness, my words. Surveillance. So we thought leprosy was no more, but we saw a case up to last year. Thank you.
Thank you, Ms. Gilliams.
Right, Mrs. Garrett-Lloyd. Very, very happy that it was only one case. Right. I'm seeing no more questions. I'll give it 1 more minute. And YouTube land is still quiet.
Yes, it appears they are sorting out their notes that they were taking.
We have someone asking, is it possible to get this information sent to us via email?
If you don't mind, may I respond? Yes, I'll respond, Sedania.
Okay.
No, we don't have this information for sharing in an email. It is possible to go back to our channel and review the session. So you may be able to get some notes because it will be left on the channel, but we don't have it for an emailing format.
And Miss Cynthia Peter says, very good information. All right. Thank you again, Mrs. Udo, and to all those who joined us this afternoon on Zoom and via our YouTube channel. Thank you for joining us. Please do come again. It was a pleasure moderating this afternoon. I am Sedania Lyon, and I'm now handing over to Mrs. Garrett-Lloyd.
Thank you so much, Sedania. I'm making a note of this, that as nurses, I think we undersell our other skills and talents because we have whole heaps, you know. So, and you said, I'm Sedania Lang handing over. I'm like, wow, let's talk about the nursing journalism that's going to happen right out there. So thank you so much for moderating this afternoon. I want to say thank you as well to Miss Fiona Gillings and to Mrs. Deborah Udu for agreeing and participating. Today, this week actually, would be volunteer week in the Sigma Theta Tau International Honor Society. And they stepped up and volunteered, and so we're able to have this session today. And I really want to say thank you to them. Thank you for the help coming out too. I heard my other PHN, Mrs. Chisholm Ford, my twin, speaking up. I've been told we look alike, sound alike. We get confused a lot. I'm not sure she's as good looking as me, but you know, we leave it at that. And then I want to thank everybody who was here to join us because we are having these sessions for all of us. The hours are important, but getting the information and being able to apply it and use it is even more important because we want to ensure we're delivering quality care. So as we usually do, before we close out, we are going to have two things. I'm still waiting if Elizabeth Pina is still in the session to go ahead and send me her picture evidence. Thank you, Madam Jodian Hall. I did get yours. A reminder, as we continue with our session, we have our final session for this week coming up tomorrow. So we hope you're going to be joining us to hear another interesting session. Tomorrow we'll be talking about elimination of mother-to-child transmission. And then next week, we have our final IPC session on the 25th on Monday, We'll be looking at management of sharps, injuries, and wound care. And then on Wednesday and Thursday, we'll have our 2 non-nursing sessions looking at professionalism. Unfortunately, colleagues, it may not be us because we may be the choir. We've had so many negative comments regarding our professionalism. So I hope everybody will turn out, because even if we are the choir, each one share one, teach one, show one, and that will definitely make all of us look better, because people love to say the nurse them. And then we'll talk a little bit about emotional intelligence and how that impacts where we need to be, because it's really a hard world out there and it can be very rough in our chosen profession. So join us, come back, and I want you to listen up. So we're trying to give away the prize at the beginning, and then we'll have a prize for the end. And then we're going to be asking a few questions if somebody else wants the second prize, right? So this is how we are going to do this. Everybody is ready? Yesterday, by the time I asked the question, somebody was able to answer and say that they were taking notes. I said, what? So let's see how many of you are taking notes and were paying attention. Today we have 4 questions, 2 from either presentations, and we're gonna be looking out for the answers. Please listen to the instruction. Put all of your answers at one time in the Zoom chat or the YouTube chat. It's a whole lot of work for us to go up and down to see who wrote the answers if they wrote them one at a time. So I am saying click so you can start typing, but don't submit it until you put the 4 answers. Everybody's ready? Let's make sure the brains are active and working and so on before we close off. Let me hear you if you're ready. Everybody ready? I don't hear any answers.
Yes, we're ready.
I'm
Let's
ready.
go.
Wonderful. All right. Question 1. Question 1. We're ready? Easy first one. What is the name of the game that Miss Gillings similarized the RES to when she spoke in her presentation? She said, you know that game, and she called it. Please put all of your answers at one time. If you're going to type one at a time, those will not count. You're not listening to the instructions. Question 2. There were 4 types of pathogens that Miss Gillings gave us. Give me any 2 of those 4. All right. I'm going to repeat the questions, So question 3. We're ready now? We got the vaccine preventable diseases. We got the diseases that were eliminated and which vaccine it was. Give me 1 vaccine preventable disease that has been eliminated, and what was the vaccine that eliminated it? And the last question started off with a big jolt. Every year, this amount of people die from vaccine preventable diseases. What was the figure? All right, so people were typing and they're double checking the answers before the ping start going. Listen up again to make sure you have it. What game did Miss Gillings similarize the RES to in her presentation? Question 2, she gave 4 types of pathogens. Give me any 2 of the 4. Question 3, give me 1 vaccine preventable disease that we've eliminated, and what was the vaccine that eliminated it? And then the last one is, how many people die globally, annually, from vaccine preventable diseases? Go. 1 minute so you can get the typing together properly. All right, Andrea, I see you were quick on the draw, but not quite. All right. Camille, I see you quick on the draw again. Camille is our prize winner. for yesterday's beginning session. Not quite, Camille. I'm giving you a couple more minutes for the typing. All right, Debbie said she was ready, but Debbie, I don't see her typing yet. I'm waiting. All right, Britia Seymour, I see you. Close, not quite. Shanette, I see you typing. We're getting there, almost. No, Andre, we're not quite there. All right, come type some more, man. We're close, you know. Close. You want me to give a clue? It look like the main one that maybe the challenge is how many people die annually, you know. All right, a couple, 30 more seconds, you know, before we declare, you know, because I know you want to hear the answer too. All right, Madam Maureen. Maureen was the winner of our prize in this round last night. No, Madam Maureen. Shanette, you're gone down, man. He's not down, he's up. Oh, you went up, but it's still more. It's still more, Shanette. Still more. Counting down. Anybody? All right. I'm going to see if we get any answers. Andreen made a bigger guess. All right. So let me make sure that my presenters are here. You know, thank you, Debbie, over on YouTube. I see you. Anybody else over there? Shanette, you're guessing now, you know. All right. So what game did Miss Gillings similarize the RES to? She said Pac-Man. So she dated herself, you know, and some of us, because if you know Pac-Man, it has been a minute, right? But age is a number, not true. And then she said there were 4 types of pathogens. And I said, give me any 2. So she gave us the bacteria, viruses, the fungi, and the parasites. All right. And then I said, give me one of the vaccine diseases that we've eliminated and what was the disease. And I got a lot. So I got the polio myelitis with the polio. I got people answering to the measles and the MMR, and I got smallpox. Wonderful. So you gave me the vaccine and you gave me the disease. What we didn't get, thank you, Andrea Lee, good try, would have been how many people die annually. Mrs. Udu, if you're able, you can just tell me because I wrote it down, you know. Annually, over 5.5 million people die from vaccine preventable diseases. Was that what you said, Mrs. Udu?
It was 1.5 million people.
What? And I heard 5.5? So somebody win? Oh my God.
That was a mistake. Because the slide said 1.
Okay, so that means I'm the one who didn't pay attention. So that means the very first person who typed in here one, you know, Andrea, am I to take it that it was a spelling and these answers are correct? Saunders?
Yes, it is correct.
Okay, so Andrea did say, she said Pac-Man, you know, but I'm assuming is the typing fast. Virus and bacteria, polio myelitis, and the polio vaccine. And she did say 1.5 million. So let me apologize because it sounded like I wasn't listening, you know. I didn't even look at the slide. I heard 5.5 million. I said, my God, all these people are dying that don't need to die.
I got it right.
So Andrea and we have Debbie over on YouTube land who gave the very same answers. Were you two communicating?
No, we weren't.
You weren't sitting beside each other?
No.
All right. So thank you very much, everybody, for participating. I am also going to do the same thing and say my number will go in the chat. I'll put it in both places. Reach out so we can talk about the prize. All right. So just message me to say it is Andrea Saunders over on Zoomland, and it's Debbie McFarlane over in YouTube. So as we close out today's wonderful session, I just want to share a little bit of information with you. It would be remiss of me not to. So let me see if I can find what I want to share with you today really quickly. Thank you all so very much for participating. You've been really, really wonderful. All right, so I'm searching through my trillion things that I have open here. And let me see if I just find it for you. Is everybody seeing my screen?
I just want a prize. Yeah.
Is everybody seeing my screen? Nobody's talking to me? You're not hearing me?
Yes, I'm
Yes,
seeing the
we
screen.
are.
Yes, we're seeing.
Wonderful. All right. So you see, for those people who know me, they're going to say I had something to do with this. I had nothing. Let me put out the disclaimer. This purple is completely by coincidence, right? But what I'm sharing with you is the homepage of our parent organization, Sigma Theta Tau International Honor Society of Nursing. This is their homepage, and we just call ourselves Sigma. We were rebranded. We previously called ourselves STTI, and then they changed it and said we'll just be Sigma. Sigma is celebrating 100 years this year, and let me tell you a little story. 100 years ago, in 1922, we had 6 nursing students who were brave enough to say, we are studying and we are not seeing anything that we can do as extracurricular activity that represents nursing excellence. And I think we need to go and make up something. These 6 nursing students had their faculty members here, and they were told to create your plan, come back with it. And they came with an awesome plan to start Sigma, and she was able to provide all the support. And so in 1922 at the Indiana University School of Nursing, this is how we got Sigma. And so as Sigma has progressed over these 100 years, Sigma is now an international organization. We have over 550 active chapters. We are in over 100 countries. And at this point, we are the only chapter in the Caribbean. And although we are geographically located at the U.S. School of Nursing, Mona, our membership is across the Caribbean and in the diaspora as well. So I was just sharing this page with you. I can always put the link in the chat and encourage you, go to the Sigma page. Even if you're not a member, Sigma is comprised of nursing students and nursing leaders, and they have resources for all nurses and nursing students. Not all of it will be open to you because you're not a member yet, but they have information and other things they've been sharing with all nurses and students, especially during the pandemic. And so you'll be able to find out a little more about Sigma, a little bit more about why you'd consider joining, all the things that Sigma is up to, and what are the things that are happening. And then you'll be able to also get some access to some resources that will be able to help you. Sigma has lots of other webinars as well. They have articles you could read, and they have resources. You will see here this section that says get resources for students, clinical nurses. When you click on that, it will ask if you're a member, and whatever is available is what you'll be able to have. So I only wanted to say to you, I'll put it in the chat, I'll share with you. When it says why Sigma, you will see it says about Sigma, about the membership. Have a quick look, have a quick read. Are you a nursing leader? Are you somebody who is leading not just in nursing, but otherwise? Are you somebody who believes in, stands for, and exemplifies nursing excellence? Are you interested in coming over into joining Sigma and doing so through our chapter? Because we are always open to growing and expanding. And I know you're learning a little bit more about us through our webinars. But just in case you still want to hear some more, I'm going to stop sharing this screen and I'll share the last one with you, because what we've done is we are going to be 3 years old in May. Do you know we're only 2 years old? And in that 2 years, we've been an award-winning chapter twice over. We have won the Regional Showcase of Excellence Award. We are a part of the Latin American Caribbean region. And Sigma has what they call the Chapter Key Award that recognizes chapter excellence. And although we're only 2, we were able to win that award as one of the chapters being recognized in 2021. So if you want to hear a little bit more, this is the last thing that we have to share with you. We want you to come on over next week, Tuesday. It's only 1 hour because we know we may want to tell you about the chapter a little bit more, and you may have some questions you want to ask us, and we'll be able to guide you through some of the process. And we are inviting you for just an hour. Come and join us next week, Tuesday, 5:45 Jamaica time. We are throwing this out to nurses all across the region and even those who have migrated, because we have many people who join 2 chapters or who find ways to give back even though they're not here. So we hope to see you next week, 5:45, for all the persons who are interested and want to be a part of our next induction of Omega Kappa members at the end of May. Once again, I want to thank you so much for joining us. See you tomorrow, 4:30 sharp. If you've been joining us from last year or for any other sessions, you'll realize by now that we are not typically Jamaicans and we don't do late. So join us promptly before 4:30. We do try to start on time, barring technical glitches. Warm thank you again to the persons who join us over on YouTube. And I close out with just a few things to ensure we're all on the same page. The registration link is closed usually at about 2 or 2:30 on the day that we're having the session. We have to ensure that we're presenting to you a professional, on-point session, and there are behind the scenes things that need to be done. So we ask our colleagues, please, it is not reasonable to want to register at 3:30, 3:45, 4, 4:15. There'll be nobody to answer you and the link will be closed. All right. And the second thing is that we have some persons who may have emailed or persons who may have not gotten any link. We are saying to you that you must complete the registration form and send everything we've asked for. That is where we are using the list to send out the information for people to join us either on Zoom or over on the YouTube channel. That gives us a way to account for the people we have registered and prepare the register. And the final thing is a reminder. It's a professional session. You are receiving CE hours. You cannot join with the name of your phone or your first name or your surname only. We cannot give CE hours to those persons with just one name or to your phone. And we have to account for your being here. Your attendance is what is required to get your CE hours. Please ensure when we send you the information, just do a quick read through to make sure we're all on the same page. We are an honor society and we stand up for just that. All right. So thank you, everybody. See you at 4:30 tomorrow. Let's talk about how we've been doing and how we've been eliminating mother-to-child transmission as we continue with our infection prevention and control and non-nursing webinar series number 3. Have a wonderful evening, all of you, and we look forward to seeing you as we continue. You may all open your mics if you can and just say bye. We are all happy to have the waving. Debbie,
right.
I did put a number in the
Thank
chat. Maybe you
you.
missed it.
Bye.
Bye.
Happy Volunteer Week. Volunteer if you usually do, keep doing it. And if you didn't, let's just find one thing and volunteer this week.
Bye.
Bye, everybody.
Good night.
Persons who are in the waiting room, if you're waiting, it means you're not using your
Nurse
full name.
Lloyd.
Yes.
Bye.
I put my number in the chat. Who missed it?
Nurse
It's there.
Lloyd.
Yes, ma'am.
This is one of your long last friend and student nurse, Nurse Andrea Lee.
All right,
from
Andrea Lee, please to message
Clarendon,
me.
to be exact.
Okay, madam. Please message me. I put my number in the chat.
All right.
All right. Bye, everybody.
Bye.